birthday. It's your birthday. You can receive guests. Hey, what's going on, world? Hey, how y'all doing? How y'all doing? How y'all doing? Oh, hey, how y'all doing? How y'all doing? Welcome to the live stream. Today is Wednesday? Today's Wednesday. Today's Wednesday. We out here doing stuff. How y'all doing? How y'all doing? Give it a second to let everybody kind of jump in over here. Hey, how are you? How are you? Welcome to this wonderful Wednesday. I'm gonna kind of pull some stuff up online real quick, see what's going on. Some stuff that I want to tell you guys what's happening, and like what direction we're going, where we're pushing forward, and stuff like that. So, we got 6 people in here. A shout out to y'all for jumping up in here. Hopefully this isn't you guys' first time here, but if it is, welcome. My name is Kevin. I go by The Boot Nurse on every social media platform, so make sure you guys check that out. Make sure you guys check out the link in the bio. 7-day NCLEX course is in its pre-launch phase, and we're doing a pre-sale, $48. I'm actually going to be adding a weekly webinar in there, so we're going to be going over different lectures, and then we're going to follow it with a Q&A. So it's going to be like a Q&A like this, like real informal. But essentially answering whatever questions that you guys have at that point. So let's see what's going on. I don't know if you guys can hear my son. He keeps calling me, and he's a demon. Something's wrong with him. But we're going to get him help real soon. But no, he's cool. He's chilling out there. I know everybody's always worried, like, go get him. I'm like, nah, he good. He good out there. He good out there. Ain't no need for me to go out there and get him. So, let's see what's going on. So here's a quick tip for you guys. Did you guys know that as long as you're within the United States and anywhere else that has an agreement, with the National Council of State Boards of Nursing, that you can take your NCLEX in any state? So if you live in Texas, but you want to go visit family members in Florida, you could actually find a testing center in Florida, and you can go and take your test there, because that's just what you can do. So they allow for that to happen. I'm actually going to post that as a little. I'm going to post it on social media. So I'm going to put it on Instagram, not really on TikTok, but I'm going to put it on Instagram. So that way people can know that. Like my little quick NCLEX tip of the week or NCLEX tip of the day, or whenever I find them, I'm just going to post them. So there's that. So what I want to know is who you are, where you're from, where you are in your nursing journey. Have you started it? Are you about to start it? Did you just today say, hey, I want to be a nurse? Are you a nurse? Like, where do you work? How long have you been a nurse? Have you taken NCLEX? Did you pass it? Did you fail it? How many times did you fail it? So I want to know all those things. I got 11 people up in here. So let's get it on and popping. Let's get it on and popping, and let's start having a conversation. We got an hour. So at 6:45, because it's 5:48 right now, but at 6:45, your boy got to go because he got stuff he got to do. So, let's see what's going on. Y'all talk to me. Tell me how y'all's day's been in the nursing world, or if you're a nursing student or anything like that. You're taking the NCLEX soon? Hey, you're going to do fine. User 6310150347582. So, it's like, binary code. But yeah, you're going to take your NCLEX soon and you're going to do fine. As long as you prepare for it, as long as you have really good time management, have accountability for what you're doing and not doing, you're going to be just fine. Remember, the NCLEX is only the beginning. When you pass your NCLEX, you literally get to the peak of a very small mountain to end up at the base of a very large mountain. So you're always going to keep climbing. So take it one question at a time, and you're going to do just great. Evelyn, you're a nurse. Oh, that's great. Evelyn, what kind of nurse are you? What kind of nurse? Hashtag not a fake nurse, right? So you took your NCLEX in 2017. Cool. I took my NCLEX the first time in 2018. Didn't pass it. Took it again twice in 2019. Didn't pass it. And then I took it again in 2020, and I eventually passed it. So no one ever... Evelyn, since you've been a nurse for a while, go ahead and tell people up in here, does anybody ever ask you how many times you've taken an NCLEX? Just passed T's, waiting to start my program in September. Congratulations to you. Is it Chardley Beauty? Congratulations to you for starting school. Just finished school. Love to see it. You're in med-surg. Hey, shout out to you for being in med-surg. I already, I knew when I was in nursing school that I could not do med-surg. And it's not because it's just med surg just wasn't really for me. I knew I wanted to go to the ICU because I know CRNA was where I wanted to go. I thought so at that point, and it just wasn't in the cards for me. So I failed the Wonderlic by 1 point. What is the Wonderlic? Please, Asia, please tell me, what is the Wonderlic? Is that what they call it? Is that like, do I need to go to Urban Dictionary and look that up? I mean, because I'll look it up. I'll pull it up right now. Oh, entry exam. I failed the entry exam by 1 point. I'm sad. Okay. Well, hopefully, based off of me talking about Wonderlic, like it kind of like brought a smile to your face. I can tell you right now, Aisha, that's not going to be the only test that you ever fail. Okay. So if you failed it by 1 point, I can guarantee you, if you figured out where that area was and you studied a little bit longer, maybe an extra hour a day or half an hour a day, I can guarantee you that you're going to shatter that exam. When you become a nurse, no one's going to be like, hey, what you get on that TEAS exam, though? Don't nobody care about that. Don't nobody care. So, fellow black man here, looking to go into nursing, you're an inspiration. I appreciate that, man. And let me tell you, there ain't a lot of us out there. There ain't a lot of us out there that work as nurses, not just black men, but just men in general. But if we want to go down to the numbers of black men, it's like 3%. So nursing is 85% women. The other 15 are men. And out of the 15, you have Caucasian guys, then you have black guys, then you have essentially what they would call it other if you go to the website. But it's like Hispanic, Asian, Pacific Islander guys, as well as other individuals. So, and I'm all about people being a nurse. I'm all about it. Like I said, it's predominantly driven by females, but I ain't coming out here trying to take nobody's job. I ain't coming out here trying to, mess up anybody's tea. Your boy's just out here because that's what he likes to do. He loves to take care of people. So it's just, it's a passion, it's a calling, but not all passions and calling have to involve bedside nursing. So just remember that. So, if you want to be a nurse, my man, go ahead and make it happen. What's your specialty? I work in the operating room. Currently, I work in the operating room, and I specifically work most with OBGYN and general surgery cases with robots, mostly with robots. So thanks for your words of encouragement. Asia, you are very welcome. Because I'm telling you right now, like if you hold on to the fact that you missed it by 1 point, all you're going to do is just be thinking about that, and then everything else is going to trickle in a downward effect. And that's not what you want. That's not what you want for yourself, like at all. So just keep pushing. And like I told you, no one is ever going to care that you didn't pass your TEAS exam. So, newsflash, I took the HESI the first time when I was trying to get into nursing school, didn't pass it. So now look at me. I'm a whole boot nurse. I've been a nurse for 3 years, and I'm out here talking to you about failure. I failed my entry exam. Nobody knew. I openly tell people that I failed it. And then I took it again, shattered it, got into nursing school. No one cares. No one holds on to that. Nextly, I can't even tell you how many tests I failed when I was in nursing school because it doesn't matter. As long as you figure out what you didn't do well on and you pass it the next time you go up for it. That's all that matters. Because when you graduate, no one's going to be like, hey, how'd you do in med surg 2? Oh, you're stupid. All right, go back to the closet and go hang out in there. No, not going to happen. So do the perspective like that. Slushy VR, I see you. Did you go to a community college or a university? So I did all of my prerequisites at multiple community colleges. I was active duty in the Navy at the time, so I knocked out all of my prerequisites because it was what my tuition assistance would cover. And then I got my bachelor's degree because I was trying to become a commissioned officer. And the only way to become a commissioned officer in the military is to have a bachelor's degree in nursing. So I did all my prereqs at a community college, and then I went to nursing school, the university level, and I graduated in 2018. So that's the route that I took for myself. I like to try to tell people, I was just like, well, what is the quickest way that can get you into nursing or get you, out to the floor and out into the field is if you can get into a 2-year community college. But now what's happening is the 2-year community colleges are so full and backed up because, it's cheaper to go. And the university route is essentially happening the same exact way. And now nursing school is so many people want to be nurses. It's so like schools are so expensive now that it's not making it impossible, but they make it difficult in some fashion. So I would say look into both of them and then figure out which way that you want to go. But that was the route I went for me. If I could do it all over again, I would have got my ADN and then started working, and then got my bachelor's online. And then by the time I got my bachelor's online, I would have already had 2 years of experience. So, do PAs still first assist with robotic cases? Let's see. Most of the PAs that I've worked with that work in the operating room, they don't. The surgeon usually has they have their own first assist, or they have licensed surgical assistants that do it, but not really the PAs that are doing robot assistant. Most of the time, you see the PAs that are in ortho, that or in neuro, at least in the hospital that I'm working in. How did it feel in the Army? Was it emotionally draining? Well, slushy VR, I was in the Navy, so I would not know what it's like to be in the Army. But I can tell you, by being an outsider looking in, yeah, the Army looks extremely draining. So, but being in the military can be very emotionally draining. Community college is free 99, boy. Oh, your community college is free 99? I mean, hey, if your community college is free 99, hey, I ain't mad at you. Hey, get that education if it's free. Are you not going for your CRNA license anymore? I'm not. I had a lot. So I was working in the ICU for a little bit, and there were just a lot of things that I didn't like and a lot of things that I was uncomfortable with. In order for you to be a CRNA, they want you to have critical care, either it be ER or ICU. But ICU, they are more tailored towards because of the drip management. That's what they like to see. And the critical care and the long-term care of a patient. So for the longest time, that's what I wanted to do. Had a lot of bad experiences in the ICU, and it just wasn't in the cards for me anymore. People ask me, why didn't you just leave and go to another one? Well, in my whole thought process is just like, okay, if it's going to be here, if it's going to be like this here, I can only imagine what it's going to be like somewhere else. And this is during the second wave of COVID. So, people were dying left and right. Nurses were leaving to go travel, and, short staffed, inexperienced new graduates like myself, and other, nurses that were on the floor. So when I tell you, we got fed to the wolves, and it was not a good experience that I had. But I've been an educator for the past 8 years. I was a master instructor. Well, I'm still a master instructor in the Navy, and education is what I've loved. Didn't think that I would love it, but I loved teaching. I love teaching a lot. And so I made the decision to get my degree in nurse education. So that's what my next degree, or my master's degree, is going to be is in nurse education, which is another reason why I created that 7-day NCLEX course. If you or anybody else knows, or if anybody else needs help on that, check out the link in my bio. It's going for $48. You get it for $48, and you get it for a lifetime. So I love teaching. I love coaching. I've been coaching for the last 3 years for nursing, and that's just where my heart lies. And I figured, why not just stay there? So that's why I didn't go the CRNA route. I'm struggling with the NCLEX. Any advice? Study for it. I would Crystal, I know that's probably not what you wanted to hear, but I would tell you to study for it. Go check out my course. But then I would study for it. Think about what you're not doing. Have accountability. Are you on a schedule? What's your study schedule look like? Or what about your time management? Do you understand the NCLEX style questions? What's really hurting you about the NCLEX style questions? Is it the case studies, right? Or is it the extended multiple responses? Is it the drag and drop? Is it the fill in the blank? Are you familiar on what the format looks like? Have you been preparing for it? Do you have a content gap? Do you not understand certain things? And when it comes to the content gap, are you able to apply what you know in order to answer a question? Are you reading your questions too fast? Are you reading them all the way through? Are you reading your answers all the way through? There's a lot of nuances that come into play in regards to understanding your NCLEX. So if that's what you're struggling on, I would definitely say make sure you put yourself on a schedule, have accountability, create a study plan for yourself, cut everybody out cut all the extra, trim the fat. If they don't need to be there, they need to go. You need to recreate the testing center as well. Computer, no phone, no snacks, no drinks, no nothing. It just needs to be you, computer. No social media, no nothing. If people start coming all up in your face, being like, "Where you at?" Go, "Hey, I'm doing a quiz or I'm doing my content. I'll talk to you in an hour." Boom, go away. Right? You got to prepare for this exam. Remember, you can prepare to go to nursing school by doing prerequisites, and you can prepare to graduate by going through 2 years, 3 years, 4 years of a freaking of a nursing program. But you mean to tell me you can't dedicate a little bit more time to passing your license? Not saying that you don't. I'm just saying that's what happens. Is people graduate and they get complacent. They're like, "Oh, I don't need to do it. I don't need to study for it." And then they're very surprised on when they fail, or they're or they're just in shock for the fact, like, "I can't believe I didn't do well on that exam." Okay, well, did you prepare for it? Some people are like that, but it's a very, very small minority of people that are like that. So that will be my advice to you. And then, of course, go check out my course. All right, what's going on here? Having trouble debating between MRI tech versus nursing. I think I could really enjoy either. So here's something that people don't really know is that as a nurse, you can work in radiology and you can specialize being a radiology nurse. Hell, you can even be a radiology nurse practitioner where you specifically work as a nurse that works in X-ray. Well, I'm sorry, that nurse that works in radiology. That includes X-ray, MRI, sonograms, ultrasounds, CT scans, like all that stuff. So that's why I try to tell people is that you could be extremely versatile as a nurse. Your license it's probably one of the most versatile and most unique licenses that you can actually obtain. If you go to nurse.org, or even if you type in on Google or Google, whatever you want to call it, put in radiology nurse practitioner and then see what pops up. Or put in nurse, or what is it, a radiology nurse. They need nurses that'll be there. And if you have the background with MRI or anything like that, that's just as good. So you could do both. That's one of those occasions where you can do both for sure. Let's see. Hey, bro, what is a good GPA for nursing school admission? So you want to have your GPA as high as possible, to be completely honest, because you are competing with every person that is applying, just like you are. Remember, like I said, you're competing against, a lot of women. 85% of nurses are women. So you're competing with a lot of women. But it's not just the GPA that'll make you stand out. It's like, what are you doing that's extra? So I like to tell people volunteer, but volunteer like with the American Red Cross where you're helping people, because when they look over your application and they say, "Hey, is there anything else you want to add?" Yeah, there sure is. Here's a letter from the American Red Cross where I volunteered X amount of hours working in a hospital, helping, do charting and help move patients and help do all these things. Those things I'm telling you, you would not believe how much volunteering your personal time to help other people in that capacity, like how far it can actually set you apart from somebody. All right. So the GPA is that you want to try to get it as high as possible. I can't really give you a specific number because some people, I got into nursing school with like a 3.6 or 7 GPA. I know somebody else that got in with a 3.2. At that point, it's like you want to get it as high as possible, but at the end of the day, it's irrelevant. But for this specific purpose of you getting into nursing school, you want to try to get it as high as possible. You always want to strive for A's. B's are okay. C's are a no-go. I've seen people get into nursing school with C's, but why even make the people that are picking, why make their ears perk up? Because they're going to tell you they want the best of the best, and to them, C's are not the best. So hopefully that helps. Calvin says, "Hi, I'm in nursing school right now." Okay, cool. Congrats, Calvin. So, like, where are you at in your nursing program? Like, let us know. So we can talk about that. ASN or BSN. So you missed that conversation earlier. If I could have gone back and done it all over again, I would have got my associates first, because it would have been 2 years of school instead of 4 years. And then I would have jumped in to the nursing field and working right as a 2-year nurse. The ASN and the BSN both take the same NCLEX. So once you start working as an ASN nurse with the same RN license that I have, you can bridge and go from RN to BSN. And the only thing you got to do is just go to class or do your classes. That's it. You don't have to do anything else. You don't have to take a license. I mean, you do have to graduate and you have to pass your classes, but you don't have to take another license, which is another thing that just really, throws people off. So if I could go back all over and do it again, that's what I would do. But everybody's situation is different. Everybody's personal beliefs and wants are different. Some people are just like, nah, forget that. I'm going straight for a BSN. Cool. If that's what you want to do you, boo. Do you. But for me, I took the BSN route because I didn't even think about nor know at that point that there were such thing as 2-year nurses at that point when I was going to nursing school. And plus, I was trying to become a commissioned officer in the military. And in the military, they only want bachelor's degree nurses. That's it. There's no ifs, ands, or buts. Like they grandfathered people in, but like in 2004, they increased it to only bachelor's nurses or bachelor's degree nurses could go and serve as nurses in the military. So I failed to get in the nursing program 3 times. Well, you're a nurse now, Evelyn, right? So you failed to get into it. So that's what I'm talking about, where we're essentially people can persevere and, understand that when you fail, it's not meant to keep you down. It's actually, it happens to help you learn. And you learn. It doesn't matter how many times. You could have told me 5 times, but you learn from what you didn't do correctly, and then you applied it, and then you eventually got into nursing school, and then you graduated. Now you've been a nurse since, would you say, 2017? So, for anybody else that feels like, they're a failure or they failed multiple times, like look at my story. Look at Evelyn's. Evelyn will tell you. So, is your 7-day boot camp live? No, it is on demand videos, and I'm actually going to start implementing this week live lectures with Q&A at the end for everybody that decides to get the program in the pre-launch phase. So I'm 19 years old. Any my armpit area? What? I'm 19 years old. Oh, and my armpit area has been swollen for months. What do you think I should do? I think that you should call your doctor. So that's one thing that's not going to happen on this right here is that I'm not going to give you medical advice. Like, I'm not a doctor. I'm a nurse. And the one thing I'll tell you is that if you feel like you have anything going on, you need to go to the doctor. So if you have like something swollen under your armpit, could be a lymph node, could be a cyst, could be whatever, but you need to go get that checked out because, you're young. So who knows what it could be? Could be a clogged freaking like sweat duct or anything like that. So Amy, go to the doctor. Most hospitals will help pay for your BSN. That's correct. So if you're working for a hospital, let's say you're a tech and you want to go for nursing school, a lot of the hospitals have tuition reimbursement. So you are 100% right, Evelyn. Let's see what's going on. Why you say she has C. diff? You don't know if she got C. diff. Don't do that. But Amy, back to you again. Like I said, we're not giving medical advice here, right? So you take everything that what people say at face value. Like, unless you are a physician up in here and you know what the diagnosis and they've seen you, don't do that. All right, Amy, take that ass to the doctor. All right. So if you're just now joining me, I got like 23 people in here. My name is Kevin. I go by the Boot Nurse on every social media platform to include YouTube. Make sure you guys go follow me on all of those social media platforms. I also created a 7-day NCLEX course. It is an on-demand course, and I'm going to start throwing some live stuff in there. But right now, we're in our pre-launch phase. It's going for $48, and you get it for a lifetime, which is 80% off of its original price. On top of you, like I said, you get it for a lifetime. So if you're one of those people that's going to be graduating like in December, it's a good one for you to get. It's definitely one of the ones that's on the cheaper end, as well as it is very content heavy, very, very content heavy. So be on the lookout for that. So if you're brand new here, I want to know who you are, where you're from, where you're at in your nursing journey. Are you a pre-nursing student? Did you take your NCLEX? Did you fail it? Are you a nurse? What type of nurse are you? How long you been a nurse? I want to know it all. I want all the tea. Also, we got 837 likes up in here. Yo, let's smash that like button. Let's get up to like 1,000. Let's get up to 1,000. Hey, we got like 20-something minutes, 30-something minutes before I get up off here. So let's smash that like button. Let's see what people are talking about. Damn, I'm a nursing major and I've gotten all health anxiety. Well, I mean, you can get the anxiety, it's okay, but the anxiety will curve. The only way to battle the anxiety is to essentially put yourself in those situations and fight through it. And the health anxiety, like, you don't want to become a hypochondriac and think that everything that happens to you is, what you read into a book. You definitely don't want that to happen to you. All right. So kind of just take it back, Close your eyes, take some deep breaths. Hey, you ever heard of guided imagery? I'm pretty sure everybody here has heard of guided imagery, right? Use guided imagery. You're on a bed of clouds. My name is Amy. I like to do whatever Amy likes to do, and I'm cool. Do that. You can do that. Just get straight hippie vibes. Just that's what can help relax. All right. So, do you recommend ICU for new grads? If that's where you want to go. I am a big proponent of you going wherever you feel your heart desires. I went to the ICU right out of nursing school, or right as my first nursing job. I interned as an RN while I was still in the military at a burn center for 6 months. I worked specifically in the burn ICU. I loved it. I learned a lot while I was there. And then I worked in a medical and neuro ICU for another 7 or 8 months. So I have a little over a year of experience in the ICU, but it didn't work out for me. So I left and I went back to the operating room. So like I tell everybody, you go to where your heart desires. And if the ICU is where you want to go, you can go. They have ICU residencies. So it doesn't make any, there's too much of a nursing shortage for people to just be like, no, you can't go. Those days where they say you have to go to med surg are over. I don't care what your professors in school tell you. They lying, I tell you. Thunder, hit that thunder, lightning in the thunder. My bad. I'm sorry. I couldn't help myself. What's behind the name the boot nurse? Sort of like boot camp. So the whole term about boot nurse is it actually has kind of two meanings. So the first meaning is the term boot. Anybody that may have been in the military at any point in time is anybody that joins the military from the beginning. You're considered a boot. A boot is somebody who knows nothing about nothing when they come in to the service. But then, of course, the longer that they're in the service, the more that they learn. So they don't, they're not considered a boot anymore. But we are still all considered boots is because we get put in different positions all the time, once a year. So we're always consistently learning all the time, all day, every day. So that's where the term boot came from. And then the other caveat to that is when I'm in my uniform, the boots represent the fact that I have some type of military background. And so it kind of has like a little twist to it. So the term boot nurse, meaning I'm a brand new nurse. I know nothing about nothing, or I am a nurse who knows nothing about nothing, but I'm consistently learning every day. So hopefully that gave you a little bit of context. Do you feel like ADN schools are more competitive to get into than getting into BSN programs? I think they're about even. From what I've seen from people, because there's wait lists for all types of schools. But I think I take that back. ADN programs are more competitive because they're cheaper than going to a university. That's why. Or going to a 4-year school. Because, nursing school, school in general is expensive. Nobody got all the money to do all that. So if you find your local community college that has a nursing program available, that's what people do. Just like when people go LPN, LVNs are, not saying that program is any easier, because it's not. It's a little cheaper depending on where you go. So that's why you see some people take that step. They'll go from being a CNA to being an LPN to being a 2-year RN and then getting their BSN and then getting their master's, so on and so forth. It doesn't matter how you get there, as long as you get to where you want to go. So Callie just passed my NCLEX LPN. Congratulations to you. Is it Armida? Armida. All right. Hey, shout out to you. And looking into getting my RN. Need some guidance on not getting into debt with student loans. Any suggestions? They have a lot of different scholarships and a lot of different programs that are out there. There's one specifically I know that essentially I think it's like the HSPS, where it's like the Health Services Professionals something. You essentially can go work for them, and they'll pay off your student loans. But the caveat to that is that you have to go work where they want you to work. So, and a lot of times this is in very underserved areas, and a lot of underserved areas, come with their own, issues, like crime, drugs, whatever. Not all the time, but a lot of those places come with that. You can also think about military service, because especially in the Army, because the Army has an LVN program. So you could think about that. They have a student loan payment as well. You can also think about working at a facility, and they could pay for you to get your bachelor's. I'm sorry, they can pay for you to get your go to RN school and get your license. So there's multiple different ways. You could get your experience as an LPN, like a year, and then go travel, make over 100K a year, because I know a bunch of people that make over $100,000 a year as an LPN, and you could save up and you could pay for it yourself. You could try that too. There's tons of options out here. Tons of options. Studying for the NCLEX. All right, cool. I hope your studying is efficient for yourself. And I say for yourself because we all study differently. But what I've realized for myself is that I'm very regimented. I'm very there has to be some type of systematic approach. Like, it's just like, hey, who do you see first? Who do you see first is a systematic approach. Like, I need to be able to go to this person before I go to here. Who's gonna die? Well, who's gonna die if I don't check on them? So essentially, like, for me, it's just like I have to do step one before I go to step two. So if your study plan works out and you have your good time management and accountability and everything else, I think your studying will be fine. Pretty prominent. Crystal asked, which ICU specialty, I'm assuming you said, would you recommend for CRNA school? You essentially can work in any ICU. But the one that I hear the most is cardiovascular ICU. That's the one that you want to work in. However, you can go to any ICU as long as you get the acuity of what CRNA school wants. And as long as you get the skills that you need for CRNA, like, a lot of it is drip management and management of a patient while they're under heavy medications. And of course, airway, huge. The paralytics, what do they do to the body? How do you reverse it? How do you take care of them? There's a lot of things. There's a lot of things that you got to be aware of when it comes to being a CRNA. But to put you in that position, any ICU, but specifically, I hear the cardiovascular ICU is with the ICU that you want to go to. I've heard burns are some of the most difficult things to treat emotionally for healthcare workers. Who's that? M. You are 100% correct. The first time I saw a trauma burn come in there, I was there was literally probably about 20 people in there, and I kind of hid. They kind of pushed me into a corner. But let me just tell you, that shit is crazy. It is wild. And then you think the stories in a hospital are wild, but when you hear about somebody getting electrocuted, and then a line worker getting electrocuted, or a guy who his mistress threw him into a furnace, or another guy who had a mental disorder brought his barbecue grill into his house, and it was propane, and he turned it on, and it set his house on fire, and there were 4 people in there, and he survived, his mom survived, but the other 2 passed away. When you hear stuff I saw another girl who got into a car accident, she got thrown from the windshield and it descalped her. So I don't know. She ended up in the burn ICU because she ended up having burns and stuff on her face, but her whole scalp was gone. It was done. So it kind of like that scene from Kill Bill where Uma Thurman cuts off Lucy Liu's head and you see her hair just. It kind of looked like that. I'm not laughing about that, but that's the only way that I can put it into context for you guys. It's wild. It'll humble you real quick because the acuity, everything from total energy expenditure to hemodynamics when it comes to your pressors, sedation medications, they're getting total body total body care, wound care, which is huge. Everybody in the burn center got a bath. Everybody in the burn center got a bath daily unless they were fresh from surgery. So imagine taking somebody who's intubated, who's burned 40% of their body, and you have to take them to get a bath, and they're kind of conscious. You can't even imagine the pain. It's wild. It's crazy. Which is another reason why I don't do specific things in my house anymore. Or why I don't have specific things in my house anymore. It'll really humble you. So, but it was definitely a wonderful experience. So if anybody ever gets a chance to work in a burn ICU, it's great. It's definitely great, especially for the compassion for the nurses and the doctors and everybody else that works there. It's good. What were your hardest prerequisite classes you took? I have to register tomorrow for fall. My hardest prerequisite class that I took was pharmacology. It was definitely pharmacology. Oh, and chemistry. Other than those two, the other ones were fine. When I did not human growth and development, but health alterations or pathophysiology. Love that class. Talks about the disease processes and how it affects the body, which is exactly what you're going to need to know when it comes to critical thinking in nursing school, and especially when you take your NCLEX, because you're going to take all those and you're going to take it with you when you start working in hospitals or clinics or wherever you're going to be working at. So I would definitely say pharmacology and chemistry. Hello, everyone. Facts. Doesn't the Army have an age they don't accept workers after? Everything has a waiver. Who is that? Who said that? Proud Yardy Snacks. Hey, everything has a waiver. So I'm not sure what the waiver is in regards to the LPN or LVN aspect for the Army. But I do know, for example, if you wanted to be a nurse corps officer, I believe the cutoff age is 42. But like I said, everything has a waiver. Armida, you're welcome. With that Fab Lifestyle Boutique. Hey, how you doing? So hopefully I answered, everybody's questions. I like all the questions that you guys are dropping. You guys keep dropping them. Hey, if you guys are new here, my name is Kevin. I go by the Boot Nurse. Check out the Boot Nurse on all social media platforms. Instagram. I got a Facebook page called the Boot Nation. Also, I have Thread, the competitor to Twitter. I got Thread going on, and then, of course, here on TikTok, check me out on YouTube. If anybody that you know needs this video, you can tell them to go check out my YouTube, and every video that I have on TikTok, it'll get posted up there so that way people can check that out. And then, of course, if you or anybody else needs help on the NCLEX, I have a course that I created called the 7-Day NCLEX course. You can check it out in the bio. It is going for $48 a month, and once you get it, which is 80% off, once you get it, it's yours forever. I'm going to start implementing weekly lectures in there to include a Q&A, essentially a Q&A about whatever you guys want to talk about. And I'm actually going to bring some other nurses that I have helped coach, as well as other nurses that can actually be in there to, answer any questions that you guys may have. So if you guys want me to start bringing other nurses on here and we can start to have a dialogue back and forth, you guys can let me know about that as well, and we can make that happen. So what I want to know is, for everybody that's new here, is I want to know where you are in your nursing journey. Like, are you a nurse? Are you not a nurse? Are you trying to become a nurse? Did you take your NCLEX? How many times did you take your NCLEX? Are you in nursing school? Where are you at in your nursing program? I want to know it all. Let's see. Not a nurse, but I work on a high-risk psych unit, and you definitely see some shit you can't unsee. Yeah. Last live, I think I talked about, I had a guy, he was probably a teenager. I think he was a teenager. He was like 15. Yeah, he was 15. Essentially, a code green happened. My man got mad because he couldn't go outside or he couldn't go do something. Was flipping out, caught a code green. They cornered him. He ran towards me. The whole time while it's like I'm ready to fight somebody, because I just don't do well with like bars and seclusion like that. So I'm ready to just, my man jumped in front of me. I didn't move. He didn't beelines to the right of me, and he rips the damn fire extinguisher off the wall. And when I saw that, I'm just like, wow, I'm glad he didn't do that to me, because my man ripped the fire extinguisher and the mount completely off the wall. So, I mean, joke's on me if the mount wasn't really being held up too well. But I've seen some wild stuff. I could never work in psych. It takes a special person to work in the psych area. They put me in the acute adolescent females. I'm good. That was a scary place. I wasn't trying to be in there. And then they put me in the acute, the other acute area for adults, which was also wild. And then our preceptors were trying to tell us, she was like, yeah, go out on the floor and mingle. And I'm just like, what do you think this is? This ain't a casino, and go mingle. Like, what you talking about? So, just what was not in the cards for me. I was doing exactly that. Acute adolescent females with borderline nope. I'm okay. It kind of reminds me, if anybody's ever seen Serengeti, or if they ever seen a pack of wolves, when they find the weakest link, they'll try to get rid of them. I literally saw that when I was in the adolescent females. You see one of them gang up on them, and then you just see them kind of hoard around the alpha female, and they just start. I'm just like, oh no. And so, they called a code green for that. That's wild. It's wild up in there. So like I said, it takes a special person. It is just not me. I have never been humbled so fast. Those girls are ruthless. They are ruthless up in there, and they will cut you hardcore. I don't know. They be shivving down a damn toothbrush and be like, "Hey, I seen way too much, like what Prison Break, Oz, whatever." Nope, no, not I. I almost went to work at Austin State Hospital because I love psych nursing, but money is not everything. You right? I'm telling you right now. Sometimes when they think about it, when COVID happened, they were paying people like $10,000 a week. People are not going to pay you $10,000 a week unless you about to go into something that you know ain't right. And I can tell you, every nurse I know that went up to New York or took these COVID contracts, they are traumatized. Let me tell you, they are traumatized. Loved when they tried to fight each other during breakfast at 8 o'clock. Ain't that right? Hey, girl, you got the wrong orange juice. And they be trying to fight each other. That's wild. I can't even believe it. Do you work? Did you work while in nursing school? Yes, I was actually active duty while I was in nursing school. I was actually working as an instructor, so I was a teacher while I was in nursing school, and then I ended up transferring from one command to another command, which is just another place where I worked. For those that don't understand that, but I ended up moving to another place while I was when I finished my last my fourth semester of nursing school, and then luckily for me. They allowed for me to finish out nursing school, like my clinicals and my actual didactic, and I graduated on time. Because for people that don't know, if you're in the military, they don't really care about what you have going on. It's all about the mission first. And as long as you take care of what you're supposed to take care of in regards to the mission, they essentially just give you kind of, you can do what you want, but you have to fulfill the mission. Because if you don't, then they're gonna be like, oh well, if you want free time, or they'll essentially kind of limit your free time by giving you more work. That's the kind of stuff that they do. You know what's up, Nurse Nelly. Thankful my hospital has awesome security and off-duty police on property. Well, let me tell you something right now, Evelyn. Not a lot of hospitals get that luxury, and I do call it a luxury because I can't even tell you how many times I worked in the ICU and I worked nights, and it'd be 2-3 o'clock in the morning, and some random person just shows up in the ICU saying, "Hey, I'm looking for so-and-so." I have no idea who this person is. I have no idea what they're carrying. Me, I'm paranoid. So I'm like, not a lot of people would like stay vigilant, but me, I'm looking at everybody that comes up there. And here's a really good example of that. There was a lady that showed up. Oh, no, I'm sorry. There was a lady that showed up, and she was like a drug overdose or something like that. She was in the ICU for 2 days. Next thing you know, her son comes up there. And when her son comes up there, he decides that he gets access to her IV and starts fucking pumping some shit inside of her her IV line. And then when the nurse saw it, she was just like, "Hey, what are you doing?" And then he ran out. They called security, but there wasn't no security up there. That dude was long gone at that point. And so now you have this lady who's now overdosing again that we had to call a code on. And now we had to give her Narcan IV to reverse her out of that. And it was just wild. Like that was a wild ass like beginning of the shift. So now that set the trend for the rest of the damn shift. So I wish I could say that a lot of us have that luxury of having security. But there's just not enough. There's not enough. More than enough, especially in places like the ICU, because and especially like on any other floor, like if you're working med surge or if you're working in tele, or if you're working in oncology, wherever you're working. In the OR, we have locked doors because, we have a sterile environment. So, not anybody can just walk past. Like we have a front desk that nobody can just walk past. And if they do walk past, then Lord help us. But I'm glad that you have good security in your hospital, like, because that's definitely something that's needed. If anybody see that news article that came out where there was a lady who walked into a NICU and tried to take her baby and she stabbed nurses. That just happened not even a week ago. So, safety is paramount. Safety is paramount, and you have to, stay frosty, keep your head on a swivel, looking out, having operational security. I'm using a lot of just like military terms. I hope everybody's picking up what I'm putting down. Make sure y'all smash that like button. I want 3,000 likes. Now, not only do I want 3,000 likes, I just gave y'all military lingo. Let's make it happen. All right. Let's see. How does taking clinicals and working work? So I worked during the week, and I did my clinicals on the weekends. So, and then of course I had military service and I had military obligations. So sometimes there were clinicals that were done on the weekends that I couldn't do because I had to be at duty, or I had quarters, or whatever you want to call it. Um, and usually they are pretty, they were pretty flexible with me. Um, but you can't make it a habit because you have specific hours and a specific time in order to get them. So clinicals worked out fine for me because I did them all on the weekends. So as you might, as exactly like you might think, I worked Monday through Friday, and then I had clinicals Saturday and Sunday, and then on Monday I went right back to work, and I did it like that the whole time. The only time I really had time off was when the semester ended. Like there was like a 2 or 3 week break in between semesters. So it's doable. You can do it. Trust and believe me, you can do it. Not a nurse. I have it. I have it. Mine, but tease is now my headache. I know one day I'll get it. So you're not a nurse, but you're trying to take the tease. So I'm assuming so you can get into school. Comfort. Is that what you're saying? Hey, make sure you guys share this too. I'm only gonna be on here for probably about like another 15 minutes. So hey, make sure you guys share this, and like I said, make sure you guys let everybody know that I do these TikToks right now, Monday, Wednesday, and Friday. All right. How long are clinicals, and is it paid? It is not paid because it's a part of your curriculum, and usually the clinicals are the entire semester. But the clinicals are based off of whatever class that you're in. So like if you're in fundamentals, you're not going to be taking psych clinicals. You'll be doing fundamental clinicals. So it takes you in steps. At least that's how it was for my school, and how it'll be for every other school. So, and no, clinicals is not paid. I wish clinicals was paid. Would have been balling out of control on the weekend, but that ain't it. So, okay, so tease is your headache. I recommended a book last time on the live. It's called Mometrics. It's a yellow book it's a yellow book called Mometrics on Amazon. It's like $33. It's a good book for tease, comfort, if that's what you're looking for. And yeah, if that's what you're looking for. Like I said, right now it's $33. I remember I showed it last time. I'll check and I'll see right now if it is, which I'm sure it is. So let's see. Mometrics. Work. Oh, okay. There it is. So yeah, right now it's going for, it's called the Mometrics ATITs 7. And right now it's going for $33.99. And the top one right here has 2,200 reviews with like 4.5 stars. So you can't go wrong. What do you think is the best and worst specialty? That's a very, that's a subjective question, because what may be my cup of tea is not yours or anybody else's. Like I said, for me, you won't see me do psych. Like psych is just not it. In my opinion, one of the best places to work as a nurse, if you're going to work in a hospital, is PACU, or the recovery area. Like you don't get any patients until they come out from the operating room. You usually have as many hands as you possibly can need. You have access to the surgeons, and you also have access to anesthesia, which makes it a lot easier for you in case you have a patient that has an airway compromise, because that's the biggest thing that we're worried about when they come out. Well, here's the biggest thing that we're worried about when they come out of the operating room is risk for bleeding and airway compromise. So like they just had a tube in their throat, they just had paralytics, all kinds of stuff. So if they have a laryngeal spasm, or if their airway just cuts off completely, or if they have an upper airway obstruction, those are the things that you're thinking about working in the PACU. But I know I've met and worked with a lot of nurses that started off in the PACU, and they love it. They don't want to go anywhere else. Now, the worst specialty to work in, I don't know. Evelyn, I think, is still in here, and I ain't trying to say med surge because I don't need her coming after me like that. But, but no, in reality, it all just depends. It all just depends, because you could work in the ER. Like I used to work in the ER when I was an EMT, but I can't do it no more. I can't. But some people like med surge. If you thrive in chaos, med surge. Hey, she ain't lying though. She ain't lying. Like, cause med surge could get hectic. But if you want real chaos, you want the ER. And ain't no ifs, ands, or buts about it. But I can tell you right now, our ER got so crazy that they had to shut it down and divert because we didn't have any nurses. There was literally like 5 staff members, and I think 2 were nurses. And there was calls for like 30 patients to come to us. And this is when I was working in the ICU, so I had a plug down there. They were just like, "Yo, we just had to divert everybody." We're like, why? What happened? They were like, "We ain't got no help." I was like, ain't that something? So, you know, it all just depends. Nurse Nellie said she loved med-surg. Me, I loved the PACU. I loved it. It was great. It was Gucci out there. What do you think about ICU and emergency? Well, Amy, I used to work in the ICU. I have a year of ICU experience. I loved the ICU in regards to training. But at the specific hospital that I work at, I did not love the fact that we didn't have support, how people were condescending, how I got pretty much slutted out to like 9 different preceptors, and for the lack of training. So I didn't like that at all. The emergency room, I haven't worked in the emergency room in a very long time, so I really don't feel like I can speak to it. But I can tell you some things I can speak to about the emergency room. They get them stable as fast as possible, and they get them out. And they get them out onto the floors, either it be med-surg or it be tele, or if they're coming to the ICU. Their whole point is to stabilize them and to get them out so they can have room for other emergencies. So, love med-surg. Wait, what is med-surg exactly? Somebody explain to her what med-surg is, please. Go ahead and drop it in there. M, let's see what she said. I'm doing a clinical psych PhD. Okay, shout out to you. And thinking about doing ER psych assessments soon, but also I'm scared. What you scared of? Go do it. You'll be all right. So you're talking about doing intake. So are you doing like social work type deal? Or are you just doing psych? You're just trying to get your PhD in psychology or anything like that? So I'm actually kind of curious to know. I loved ICU training and patients. Yep, I hated the ICU management and culture. Hey, that statement right there that she said in a nutshell. The training stuff that they would give you, like learning about CRT or balloon pumps or hell, even vent management, hemodynamics, learning about the drips, even time management. Like it's all great. It was all great. The patients, the patients are going to be patients. They're the most critical in the hospital, right? But the culture and the management and the lack of support, not with it at all. And I've had some people come to me, they were just like, hey, if you can't hack it, well, what did they say to me? They was like, bro, if you can't hack it, just say that. First of all, I called him a clown. 2, how are you going to determine what I just said off of 19 seconds of a reel or a TikTok? Like, who's the real fucking clown out here, bro? Like, don't do that. I don't got no problem trolling people. I do it really well. So there's nothing you can really say up in here that's just going to make me be like, how dare you say that to me, right? Come on now. Let's be real. Training to become a psychologist, but also do research. Well, yeah, because that's what a PhD does, right? You do research. So, okay. Hey, shout out to you. Go ahead and get that PhD. So we can call you Dr. M. I'm assuming that's for like Emily or Emerald. Your name Emerald? No, let me stop. But that's so real though. Hospital care is so interesting, but the administration/leadership stuff is the worst. It is the worst. It really is the worst. It's because, remember, the administration, it's all about the bottom line. It's all about how much money they can save and how much money they can save and how much money they can put in their pocket. So what is the main reason patients come to the hospital for what? What is the main reason patients come to the hospital for in your specialty? So what do you mean? Like, what do they come for, like, into my hospital? So if people come into the hospital to see me, they're having surgery. So usually it's outpatient. But then also there's people that show up that are emergent that also get surgery. So I'm pretty sure I'm not going back to the hospital again. I'm pretty sure you're not too. It would be very smart for you not to do that. I would agree 100%. Because I don't know if anybody's been paying attention, but Ascension Seton, I believe, they were on strike. I don't know if they're still on strike anymore. But as the nurses tried to go back to work to take care of their patients, the administrator was standing out there with the police, and they were just like, they're not allowed back on. They're not allowed back into the hospital. And it was just like, okay, what now? What's the real problem? You got people that want safe nursing ratios and safe practice, but you're keeping them out. make it make sense. So got to go, but have a good night. You too, Em. Thanks for coming to the stream. And let everybody know that I do this. And you ain't even a nurse, so I appreciate you being here. But let everybody know. And you have a good night as well. What do you think about being a travel nurse? I think that being a travel nurse would be great if that's what you want to do. So, but the one thing I will say is that you want to get tons and tons of, well, I wouldn't say tons, but you want to get at least a year to 2 years of experience in the prospective area that you work in before you go travel. You do not, and I repeat, you do not want to go work as a travel nurse and not have any experience. When I tell you they will throw you to the wolves, they will throw you to the wolves badly. And then it'll make it, not only is it embarrassing for you, but then it's just like, man, I don't want to do that. So everything that you think about when it comes to like having imposter syndrome or are you good enough to do that, like it'll amplify like times 10. And a lot of people think that being a travel nurse is where the money's at. Granted, you can make some very, very good money as a travel nurse, but there are other avenues in nursing that you can do to make you some money. So your tips and pointers. Oh, your tips and pointers helped me pass NCLEX. Thank you so much. You are so welcome. I appreciate it. Hey, you know what you could do? You could either do a video testimony, send it to me. I'll put it up on my website. I'll post you all over my social media. I mean, you could do that, right, babe? I'm just saying. So, no, but hey, shout out to you. Congratulations. Repeat test taker. Love it. That's one thing I tell people. Hey, let them know. Remember when I showed the breakdowns? Remember when I showed everybody my breakdowns and when I fail? Don't matter. Don't matter. It does not matter. No job will ever ask you how many times you failed at NCLEX, ever. All right. So you come out here, you study for it, you do what you need to do, take the pointers, and then you excel. And now you never have to now you never have to take that exam again. So you never have to take that exam again. So like I said, congratulations to you. You're super coachable, you adjusted, and you conquered. So congratulations. I'm super proud of you. Everybody else in here is super proud of you too. It's a huge, huge accomplishment that people that are not nurses will never understand. So like I said, congrats. Yes, and I might do a little video. Hey, you can do that video. You can send that to me somewhere. I'll put it somewhere. Hey, because if you go to my website, I have people's testimonies posted all over there. Because that's the one thing that I love is talking about people who have failed the NCLEX and then they passed it. I love it. I love talking about it. Love talking about it. Is it true if you fail a class a second time, you have to switch majors? No. Amy, where are you getting this information from? First of all, I love the fact that you were asking so many questions. But where did you hear that from? Let's see what's going on here. Who is this? It's Caitlin. Hey, I'm starting in the OR as a new grad. Have you worked in that specialty before? Thoughts? Yes, I actually do currently right now work in the operating room. And I work specifically with the robots and I do OBGYN. I do mostly OBGYN with general surgery with the robots. So my thoughts are when you first start working in there, tell them where you want to work at. Say like, hey, you can either work in ortho, you can work in neuro, you can work in cardiovascular, you can work in urology, you can work in with spines, you can work in GYN, you can work in general. They actually have, you can do eyes if they have it. You can do ENT. You can do oral maxillofacial. I actually worked in an oral maxillofacial surgery clinic for almost 2 years as a surgical tech. And who would have thought it would have been a great spot to be? So my nursing program tried to say that about failing. It's a scare tactic. It is a scare tactic for real. Because I can't even tell you how many tests I failed. A lot. So you're very welcome, Caitlin. That's a rule in my college. I don't know how it's true. Yeah, it's a scare tactic. It's a scare tactic to tell you that, hey, you need to buckle down and you need to pass. That's what they want. So I'm a sterile processing technician and planning to go to RN. Okay, shout out to you. You could do it. And you work very close to nurses. And by close to nurses, I mean, in the operating room. So, bro, I literally failed every med-surg test first time around. For real. I almost failed fundamentals because I was so hard-headed because I have a lot of medical background as a corpsman, and I thought I knew everything. And I was answering things based off of real world versus the book. So you needed a 75 to pass fundamentals, and I got a 78. Don't how that happened. I mean, I do know how it happened, but I'm just saying. So, all right. I think we reached that time of an hour. Man, time goes by fast. So I'll answer one more question and then I'm gonna head out. So whatever question y'all got, let's hear it. And then if you guys have any other questions, make sure you guys check me out on Instagram. Also check me out on the check out the Facebook page, the Boot Nation Facebook page. And of course, ask any question. You can send me any kind of questions that you have, and I'll try to get to them on Instagram or on TikTok. And then, I got you. I'll be able to answer the best of my abilities. And if not, I will point you in the direction who has the answer that I don't have. So what other questions you guys got before I bounce? Amy, I know you got something. I know you got something for me. Go ahead and drop it. Go ahead and drop it. Oh, okay. All right. I guess not. I guess Amy ain't got nothing for me. So with that being said, I'm going to go ahead. I'm going to wrap this up. I appreciate everybody that came through the live stream. We got 4.1K likes. Hey, I appreciate y'all. All that does is just push this out to other people that may need it. Like I said, check me out on all those social media platforms. If you or anybody else you know need help with NCLEX, I do coaching at thebootnurse.com. You can also check out the 7-day NCLEX course, which is in its pre-launch phase. It's going for $48. $48. Eventually, it's going to go away, so you better get it while it's there, and you get every update until the course is complete. So it'll be there. What is the difference between BSN and RN? So your BSN is your degree, and your RN is a license. See, somebody got the last question. But the BSN is your degree. It's something that you get when you graduate school, obviously, right? And then the license is the exam that you take in order for you to practice as a registered nurse, or you practice as a licensed practical nurse, either one. So, but yeah, that'll be it for the stream. Like I said, go check those out. Those links are in my bio, and I will catch you guys Friday. Peace.